Hi, I'm Dr. Randy Martin. I'm pleased to be joined by Dr. Khan from Cambridge in the UK. We'll make sure you know it's Cambridge in the UK. Dr. Khan's going to talk to us about the TARGET trial. Thank you very much for joining us. Tell me, what is the TARGET trial?
Thank you very much for having us to talk about the TARGET study. So the TARGET study was designed to try and improve outcomes in patients with heart failure. So it was designed specifically for patients who are undergoing resynchronization therapy. So the idea of the study was that we do recognize that how you position the leads within CRT is very important. So the study was designed to see that if you targeted the lead to what we think are optimal sites using speckle tracking echocardiography, then that would be a better outcome than just putting the leads in without any form of echocardiographic guidance. So that was the primary sort of hypothesis driving the study.
And which is obviously very, very important, because that's been the whole push, you know, why MR has been used, and people, you know, want to put it where there's dead myocardium
Absolutely,
or stuff. So I'm intrigued with that. What did you find in the TARGET study?
So what we did find is that with speckle tracking echocardiography, you were able to identify the sites, and you were able to get to those sites when you had a targeted approach in about 61% of patients, compared to 45% in the control group by chance.
Okay.
And that 15–16% ability to get to your optimal site drove our primary endpoint of remodeling within the left ventricle, and we showed an absolute difference of 15% improvement in response rates. So in the target group, from echo response, we were seeing 70% versus 55% in the control group. And we were seeing improved clinical symptoms as well. We were seeing improved NYHA class in this group as well.
The excellent outcomes. I know what you're doing, but for the audience that doesn't understand the speckle tracking and how you did, how exactly were you finding the right site?
Right, that's an absolutely key question. Speckle tracking has really emerged in the last few years in two areas really. Primarily it's emerged to try and identify those very late areas of the heart in this resynchronization population. But also data that we put out last year, as well as additional data that's come out over the last few months, does suggest that the speckle tracking software can also detect scar. So we used a combination of the two. We were looking for those late areas which were free of scar, and we knew that if you could get to a late area which is free of scar, that would be your optimal site, and try and target to that area.
Do you think this technique holds a lot of promise for the future? Because that's the big issue in CRT, one of the issues.
Absolutely, yeah. I think the promise of this technique is and I'm going to put this in a little bit of caution, but the relative simplicity of the application of the technique.
Right.
Having said it's simple, it does require training, it does require some expertise, but once you get your hands on it, you can actually roll it out to non-specialist centres, non-university centres, and I think many hospitals will be able to have accessibility to the technology and be able to practice it in all their patients.
Super. Dr. Khan, thank you for joining us, and thanks to all of you for joining us. For CardioSource Video News, I'm Dr. Randy Martin.